how do you even think about the risks that are associated with the study, and is it to your child's benefit to really partake in the study? There's no one answer to that. Each family, the answer is going to be different. Yes, there are risks of every procedure. You say, well, if my child were not involved in this, they wouldn't have that operative procedure. They may need to have a PICC line or a port put in, which is a longer line to allow them to have many different bloods being drawn. These are things that normally wouldn't happen to the child, but you're putting them in that situation where they need to have it happen for the trial to be completed. So, you're looking at comforts and discomforts, and you're always going to be there as a parent to see the child throughout their procedures in general, and are you comfortable with that as well? Obviously, any investigator, any facility, any procedure, any clinician working with a child always tries to make them as comfortable as possible and never puts them at unnecessary risks that aren't needed. But they may feel some discomfort. They may feel some pain. They may have an adverse event, which is a side effect to anything, even if it's a bruise from having blood drawn. How are you going to feel about that? And I think you really need to think about that. The risks are not necessarily of the study procedures. The risks can be of, well, my child's involved with this, but I have a friend with the same, and their child has the same disease and they're not involved. They couldn't get into the trial. Is that going to have any impact on me, that I am taking advantage of this and they're not? And so many people network now with these rare diseases that may certainly come up. So, that's a risk, communication risk, a guilty risk, a benefit. You say, well, we're lucky. We're one of the lucky ones that got in. But we don't know the outcome of the trial. This treatment trial may prove beneficial. It may not. And so when you want to look at benefits versus the risks, the benefits are harder to assess until you're going through the trial. And at each visit, you're asking yourself that as a parent, is this still going okay? Is my child feeling any better? Is my child doing any better? And it may not be obvious. It may be obvious by what the physicians see, maybe by the blood that they took and the biomarkers that they're looking at. Their test scans or something like that may prove that this is improving something, but are you seeing the benefit? So is that something you're comfortable with, to see them go through what they're going through and not experience some additional improvement or comfort?